I need to do first is adjust the gain. It's variable between patients naturally. So I do that by sliding my finger left to right, right to increase, left to decrease on the screen. And we're getting a beautiful picture. But now I see that I want to change my depth. So I'm going to drag the tissue down a couple of centimeters till I frame the picture just the way I like it. Now immediately we notice that we're getting really nice definition of the endocardial border, both in the septum and the posterior wall. We're seeing good motion of the mitral valve anterior leaflet. And if I tip just right, we can see the aortic valve clearly in profile. And we get good definition of the posterior pericardium and the definition against the posterior myocardium. And again, the blood pool is spectacularly contrasted from the tissue. As I pan in, we get into the aortic root. You see the valves moving. I'm going to twist now 90 degrees to go into the short axis view. I'll pan up so we see an on-fast view of the aortic valve. And there's a beautiful trileaflet valve. I'll come south to get to the short axis of the mitral valve. And I might even gain this down just a touch. And then finally, I'll come down to the mid-ventricular level, where we see a nice cross-section of the papillary muscles, and on down to the apex. Now that I've done my trial run, I'm going to capture some images, which is really a very simple process. I can capture a clip by pressing the record button, and we default right now to 3 seconds of capture, but you can make it 6 or 9 if you wish in the settings. If I want, I can freeze, select a frame, there, and that one, and capture a still. The image button is right next to this, the A button. I'll unfreeze, go to the short axis, come back up to that aortic valve, and we can see a little bit of the left main coronary artery coming off too. Now I'll clip this. Clip that mitral valve. And the mid-ventricle. Breathe out for me if you would. Just breathe. Good. Hold that. 3, 2, 1. And breathe normally.